Everyone. Today, my awesome guest is Dr. Rachel Hamel. She is a brain health expert and speaker in San Diego. Dr. Hamel specializes in craniopathy, neurologic rehabilitation, light therapy, stress management, emotional healing, and genetic-based nutrition to help individuals of all ages achieve optimal health and well-being. Her goal is simple. The brain works at its highest potential when all systems of the body are in balance: mechanical, chemical, and emotional. Her practice is focused on healing from the inside out, each system starting with making sure the brain has the right environment to heal. Her 5 systems of healing include brain, water, food, toxins, infections, emotions, and cellular electricity. When you work with systems of the body, you achieve results. When you chase symptoms, you're always looking for answers. So here's your different facts about Dr. Hamel. She is a certified craniopath and considered an expert in the brain field for her knowledge of brain function. She is only one of a few handful in the entire US. Very impressive. Although her field is predominantly male, she strives to bring more awareness and educate in this extremely important care. Also, Dr. Hamel overcame 2 years bedridden in a 9-year battle with chronic disease, depression, and immune system dysfunction. It was through this process that she learned different techniques and modalities to help decipher what's going on in individuals and ultimately to heal herself. She believes in systems, not symptoms, and has a full body approach to healing. Finally, she is a published researcher, has published 4 papers in national and international chiropractic publications, and currently working on her first book about the brain. Very impressive. And welcome to the Heal Your Natural Wellness podcast, Dr. Hamel. It's great to have you here.
Thank you so much. I'm so happy to be here today.
Awesome.
I'm excited.
Yes, I am too. This is a topic that we've never discussed before, so you guys are absolutely going to love it. And as usual, we're going to jump right in. So, Dr. Hamel, why don't you briefly tell us about your journey as a cranial physician and how did it all start with craniopathy?
Sure. So as my bio kind of mentioned, I dealt with a lot of health struggles pretty early on in my life. And so all of those struggles kind of led me into more of the alternative form of medicine and an alternative form of health. Now, it was a very long journey for me to regain health, but all of those things that I learned along the way have now created the practice that I have today. And when I was actually in chiropractic school, when I decided to be a chiropractor initially, it wasn't until I went to chiropractic school, and mind you, I was still very, very ill at that point, but I knew I had to go and learn to gain more knowledge that while I was in chiropractic school, and they don't teach you anything about the head or the brain or anything like that of what I'm doing now. But I met one of my key mentors who's a craniopath. And I went to him for, another layer of healing for myself. So there's been many layers. And he introduced me to the world of craniopathy, and I saw huge results for myself. And that kind of started the journey for me. I studied under him, practiced under him for several years. And then when I branched off and started my own business, I started incorporating that with just many other healing modalities to kind of get all of the different levels there is to really healing, and healing really from the inside out.
Beautiful. It's interesting because that's actually one of my slogans. I've been doing this for like 10 years. I'm the founder of healingnaturally.com. And so I've used that healing from the inside out, address the root cause versus masking the symptoms. And so, this is pretty relevant, guys, and how we always talk about, functional medicine, alternative medicine always focuses on addressing the root cause versus, unfortunately, conventional medicine uses medications and other methods to merely mask the symptoms, and you really don't know what's going on behind the scenes. So thank you for explaining that. It's a beautiful start. Excuse me. So now we're going to move to the next question. Why don't we talk about chronic tension, how chronic tension slowly chokes and starves cells. That's a lack of oxygen. So I found in one of your posts, this really caught my attention. So tight tissue doesn't accept blood flow well. When you release tension in your body, it has a huge impact on healing because of oxygen and blood flow. However, many people chase chronic tension patterns. This was really interesting, and your post says chronic tension slowly chokes and starves the cells, like we said before. Why don't you tell us a little bit about that?
Absolutely. So when we talk about tension in the body, and this is basically how I work and run my practice, is I focus on different levels of healing because the body works in different systems all the time. And for instance, if an individual is coming in and say they just want some nutritional help, for instance, if that body system is, number one, not accepting oxygen, which is always the number one thing that I focus on in my practice first, it doesn't matter what we give them. We can give them all the great nutrients in the world, but if we can't get blood flow, if we can't get oxygen to a tissue, we can't get nutrients into a tissue. So what I meant from this post is that a lot of us in some point in our life have forms of tension. And for instance, if you think about the shoulders and the neck being really tense, which is a very common thing that we struggle with. And often individuals will just go and, get it rubbed out or do things to just stretch it out, but it keeps coming back. That is also a fault in the chiropractic world too, where they just keep getting treated for the same exact thing all the same time.
Right.
And so when we look at tension, it's a different way of looking at it, in the sense of when you think about something tense, there's nothing really coming in and out. And in order for natural processes in our body, organs, cells, nerves, they need oxygen and they need glucose and they need water and they need minerals. And if something is really tight and locked up, then that tissue actually starts to die. The cell starts to die because it starves. If you don't get nutrients, you starve.
Right.
And that happens in the brain, that happens in nerves, that happens in muscles. And so when we think about tension, we don't just think, oh, you need to stretch it out. We ask more of the whys of, why is that tension there? What is that person protecting? What is their brain telling them to do that's creating that chronic tension pattern? And how do we kind of eliminate that tension? Because if we don't, we're not really going to be achieving what we need to, because again, the oxygen, the flow is not happening. And that's kind of why, number one, with every patient that comes in, I make sure that their airway, which is what I talk about in a lot of my posts all the time, is always open. They can breathe out of their nose. They can breathe all the way to their diaphragm. Oxygen is life. Oxygen is key. And if someone can't do that, then they're going to be chasing things all the time, whether it's infections or nutrients and things like that, because they just don't have the environment for healing. So that's kind of what I meant by tension patterns. And that tension can be from anywhere. It could be in an organ. It could be in a muscle. It could be,
anywhere,
wherever it's at. We just have to get the flow and opening happening in order for those systems to work more effectively.
Wow, that's incredible. I don't think I've heard of that. I have heard of how important oxygen is. And you see, guys, how important it is to find the right partners, as I like to call it, like Dr. Hamel, where they actually dig deeper in terms of, this is pretty important. We all have tension. I've had herniated disc, and I eventually said, okay, I need to find someone who's going to find the root cause of this. Like, we can't just keep going, and a long time ago, I had the cortisol shots, which I didn't know better then, and that's just like not even worth mentioning. But it's very important to find the right practitioners and physicians to help you really get to the bottom of why you're feeling a certain way. So never underestimate, your body is always the first thing you should listen to. Excellent.
Yep.
Thank you for
Pain is
answering that.
just a signal. Pain is just a signal. It's just a signal your body is telling you that something is wrong. You know, if
Right.
we mask it, we're not really getting that information. And so the same thing with attention. If it's chronically tense, your body's trying to tell you that something is wrong. So you just have to be more investigative and figure out the whys.
There you go. And actually, it's funny. I just made a short podcast on before we met on chronic inflammation, and there was something along those lines of like where it says, you know, inflammation in a certain area, pain is indicative of something your body's telling you over here, you know, something's wrong. Come and check it out. Thank you so much for answering that. We're just going to move to the next question. So in one of your Instagram posts, you share there was a cute baby with what we commonly call the Flathead syndrome, and the picture showed only 3 weeks difference of therapy, and that was incredible to see. Why don't you talk to us about the importance of proper craniopathy care in the developing infant and child, so we don't see these occurrences, and why is it not out there like we see this often?
Yeah. So let me first just explain what craniopathy is. I think that'll sum up some
Please.
of the misunderstanding. So craniopathy is just a fancy word for the movement of the bones of the head. So just like every joint in our body moves, our elbow joint, our knee joint, our hip joint, there's actually joints within our head where all these bones come together and they move. And again, they move because, like we just mentioned, we need oxygen, we need glucose, we need lymphatic fluid flowing. If we have any tension or pulling, again, in that system's movement, then your brain is going to react in a certain way. It can only do what it can do in the environment that it has. So that's why I always start there. Now, when we talk, so say an adult comes in first, and we talk about what causes this motion to be improper, we actually always start with someone's birth. So someone's birth actually determines the whole trajectory of their life initially, because this is the first instance we have in our whole life of actual physical trauma. You don't really think of it as trauma, but some births are pretty traumatic if you've seen them.
Yes,
And
definitely.
then add in, you know, forceps or vacuum if they use anything to that nature. And that is, you know, God made us all beautiful and created beautifully. And sometimes the things don't go right back into the space that they're supposed to. So we really look at a timeline of a person. We look at all of the things that are affecting the way that their cranial system has been moving or their cranial system has been impacted. And when we look at a child, I get really excited working with children, because in that sense, you get to change how that child develops and how that child grows. Because just like I said, that first instance is how your body compensates for the rest of your life. If we can take off the pressure off the brain, if we can take off some of those nerves getting compressed or pulled or pressed on, then we can change how that child develops and grows. And what's really cool is from the age of 0 to 2 years old, we have the most or biggest change in brain growth in our entire life from 0 to 2 years old. So if you think about as an adult, we're actually chasing a lot of things that we've had as an infant or as a child. As a child, you know, again, they're supposed to hit these certain milestones, and they're supposed to reach these certain neurological stages. That's very important. If a child is not hitting some of those milestones, it's not, oh, you know, they'll catch up. They're trying to tell you that something is not right in this neurological system. And that sets literally the trajectory of the health and healing of their life. So when you see that photo of, you know, Flathead syndrome, it's not, oh, you know, might just not lay him on his back and he'll grow out of it. Like, that's, if you look at the pressure on the brain of a flathead,
Wow.
you look at how impacted, how much of that environment on the inside that brain has to compromise, and it has to compensate. And all the there's so many nerves in there that control every function of our body, have to compensate. And so when you look at it in that nature, you say, oh my gosh, there's no way I wouldn't do that for my child. And when, families know that, they are definitely more receptive to that. And that's part of my goal, is to broadcast this more and wider and worldwide. But the reality is why it's not out there is craniopathy in general is not really widely taught that much.
No.
It's not taught in chiropractic school. It started from osteopathy. And there's many other countries, like European countries, that utilize it a lot more than the US does.
Mm-hmm.
But osteopaths here in the US, they're just primary care physicians. They don't utilize it. They're not encouraged to utilize it. So there's a very smaller amount that are actually using it to this advanced level of changing the neurological dynamics of a person. And you can do that really easily in an infant. Their heads are very soft. They're very malleable. Right. They don't have to wear helmets and stuff like that. That stuff most of the time is it's heartbreaking to watch.
It is.
It's heartbreaking to watch, and it's painful, and oftentimes not as successful, because you have to look at the whole body as a system again. And so that was kind of the importance, really, is brain function, is neurological function. If a child has a severe birth or a pretty traumatic birth, then there's certain parts of the brain that get shut off. And, and a part of that brain is called the frontal lobe. And the frontal lobe is really key in moderating the rest of our brain. So if you think about that, even as a child or an adult, if that system in our brain isn't working, it's kind of like the regulator. So it's going to regulate other parts, whether it's our mood or our emotional system or how we react to things.
Wow.
If that is not on board with the rest of your brain, because they don't have that environment properly, then those other parts of their reactions start to be limited, or they start acting out, or they start not sleeping well, or their immune system is compromised. So it's all about regulating and making a better environment so that they can grow without a lot of the interruptions that they shouldn't really have.
Whoa, that is so mind-blowing. And it just leads me to ask you, for example, so I have two questions, and I guess you can answer them in the order that you want. First, what are some of so you already explained, like of what would happen if you don't address that issue in infants. So, for example, for an adult, what could happen if that wasn't addressed as children, and they have the Flathead syndrome? What could be some of the ramifications of not having addressed that? And can an adult reverse it, or is it too late?
Yeah, well, like I said, most of what we're doing as adults is oftentimes chasing what we could have done as a child.
Right.
But yes, you can still change dynamics in the brain. There's a lot of neuroplasticity in the brain, and you can change a lot of different things. We're always growing and dynamically changing. For a child, if the brain and the nervous system, which controls everything in your body, controls every organ, every function, every muscle, if that is not at its kind of optimum potential because of some of this wasn't being addressed, then you're going to find kind of throughout the life, maybe that child was sick more often. Maybe that child starts to develop allergies. Maybe that child starts to not being able to regulate their mood, or they're constipated, or they aren't sleeping through the night, things of that nature. As an adult, you would not be surprised how many people come in, and when I go through the history of their life, they've had multiple concussions, they've had multiple head injuries, and they brush them off. And they say, oh, yeah, nothing happened to that. I'm like, no, this is a really big information here. Yes. Do not breathe over that. And there's a big misconception, because when you get into the concussion world, there's like, oh, it's just terrible. There's not good healing modalities there. And so as an adult, you take that information as a child, and you stack that up. And then you take things as an adult, you don't even have to hit your head to have a concussion, but did you rattle your head? Have you been in any car accidents? Have you had anything that disrupted that environment? And we add those up. And then we say, okay, this is your history and this is where you are. And so that's going to determine how long potentially it could take for that person to, heal. But healing can happen as an adult. It just takes longer because now we have all these patterns, and now we've compensated our whole life, and now we move differently, and now we breathe differently most of the time. So it takes a lot longer time, kind of basically reverse all these patterns that we've created just to survive, because our body's always trying to survive, and to undo some of those things, and then we kind of start at ground zero, and then we kind of rebuild it back up from there. It is definitely possible as an adult. I'm a product of that. It just unfortunately takes a lot longer than an infant would.
Gotcha. Awesome. Thank you for answering that, guys. You know that if you have any of these symptoms or flathead symptom, you could definitely look into it and work with someone like Dr. Hamel to help you potentially achieve better health. You never know. These things are not, unfortunately, addressed in conventional medicine. And so it's important that we're talking about this so you know where you're at. Awesome. Thank you for answering that. Now we're going to move to the next one. What do you tell us about dysregulation in the nervous system? You had a post that really caught my attention, and it said hypersensitivity, a dysregulation in your nervous system. So you were saying you hear this quite often. I'm very sensitive or hypersensitive. I react to everything. And you were saying in terms of your nervous system, it is safe to say that things that are not balanced. You have two distinctions in your nervous system: the sympathetic and revs you up, and the parasympathetic, which calms you down. So why don't you talk to us about this? I find it pretty fascinating.
Sure. So, tracking back to when we talk about the nervous system, we're talking about the brain, and we're talking about all the nerves that come out of your spinal cord there. So you can just think of it from your head to your feet. And your nervous system, like I said, it controls everything. So it controls every function of your body. And there's two different distinctions in your nervous system. There's the sympathetic nervous system, which is, we tend to call it the fight or flight, meaning it needs to be upregulated when we are caused with a threat to either decide to fight the threat or to run away from the threat. And then there's the other side of our nervous system called the parasympathetic nervous system, and people generally call it the rest and digest, meaning we need that part of our nervous system regulated to be able to get into a state of calm where we can digest our food, where we can sleep, where we can effectively bring things down to a lower level. So what happens is, when we get a dysregulation in the sympathetic and the parasympathetic, that is where we see a disruption in health, because we really need a good balance of these. We need the sympathetic revved up to fight stress, to fight things. But the problem is when there's a dysregulation somewhere, it could be a trauma, like I just mentioned, like a concussion or a trauma of birth, or an emotional trauma, or you got hit with a crazy infection or a toxicity, something like that. Then what happens is, or chronic stress, who hasn't had that at some point in their life?
Yeah.
What happens is the sympathetic starts to raise far above the parasympathetic. And what happens is when you're in a state of chronic sympathetic, we call it dominance, is you become hypersensitive, because you no longer have that regulatory system kind of managing the ups and the downs very effectively. And so what happens is that first we have to deal with regulating and bringing together that nervous system. Because if we just try and go maybe attack the toxins or whatever it is effectively, again, it may not be as successful, because the brain is like super sensitive at this point. And if we throw another thing for it to do, say get out toxins, oftentimes it doesn't either work for a person or they crash. You know,
Mm.
they crash, they're in bed, or they just get worse in some instances. They get more sensitive.
Oh, wow. That's very
So
interesting.
you really have to look first and foremost at any protocol as how do we best help heal and bring balance. The body is always craving balance. And when your brain gets in that really sympathetic, high sympathetic state, it really has one focus to keep you alive. So it's going to focus on, you know, your lungs filling with air, your heart beating. And so some of those other functions, like, say, digestion or emotional balance or
Yeah.
sleep, they're going to go by the wayside because those really aren't important to keep you alive. So if we then start to change how the nervous system works and we start to say, okay, let's give you a little bit of help and let's balance this nervous system a little bit. And how I do that is through many different ways, but you can do that through many different modalities. When you do that, then your brain is like, okay, and your nervous system like, okay, I have a little bit of environment now to work with. So now we can go start to work with other things. And I've had people just regulating their nervous system in general, just doing craniopathy care, other
Mm-hmm.
types of modalities to calm their nervous system. Some of these bugs or toxins or whatever clear on their own. Their body's like, I got this. I just needed help to regulate it together.
Mm-hmm.
So
I'm sort of cut you off just real quick. Wanted to jump in and ask, what are some of those modalities that you use? Let's just say mention like 3 or 4 that you use with your patients to help regulate or balance the nervous system.
So the first thing I do is I just do craniopathy to reset. You know, a lot of your parasympathetic nervous system resides in your head, and it resides in your tailbone.
Mm.
So when I work with those and balance those effectively, the body naturally goes into a very calm state.
Oh,
Now,
wow.
people can get into other states by stimulating some of those nerves there. One is through diaphragmatic breathing that really stimulates the vagus nerve, which we will talk about later, but that's one of the parasympathetic nerves that is very trendy. There's a
Mm-hmm.
lot of them though,
Yeah.
and you can stimulate that through diaphragmatic breathing. Um, you can do other different types of modality like light therapy. So there's
Mm-hmm.
different wavelengths of light that really start to calm your nervous system, start to heal your nervous system. Those are
Just
yeah.
yeah, I'm sorry, just real quick. Like, so do you prefer, like, because I've heard of recently, I was reading a study which is, it blew my mind, green light therapy. We all know that red light therapy, far infrared light therapy. What is your preference when it comes to treating this?
When I'm
With the, with,
specifically looking at like nerves and rehabilitation of nerves, I primarily use red light and infrared, but they're at different frequencies and they're at different wavelengths because you know, the brain is always craving different things to do. That's why we should always mix up what we're doing all the time.
mm-hmm.
So when you do it at different frequencies, different wavelengths, we can achieve different results. So I tend to use those the most. I have
Gotcha.
used other colors like green light and blue light and yellow light and like a deep purple light for specifically for like concussion cases or for vision. Some of the cranial nerves that deal with vision, just calming them.
Mm-hmm.
But those are a little bit more customized to the patient, and we determine what colors they really need to help then further calm down the brain a little bit more. But color therapy is pretty awesome for regulating the nervous system. And you just have to find kind of what either calms it down or revs it up that's more helpful.
Gotcha. Perfect. Thank you for answering that. Awesome, guys. I wish you were closer. I almost want to go see you like this week. Everything we're talking about is so phenomenal. Guys, if you are in the San Diego area, you could definitely visit Dr. Hamel. And I'm going to put all those links on her dedicated page on my website so you could find her and all of that good stuff. Thank you for answering that. Now we're going to move to the next question. Why don't you tell us about leaky brain and what causes it? This was another one that was brand new to me. Never heard of it. You have all these phenomenal things on your Instagram information, if for a better word. So yeah, why don't you tell us about also leaky brain and what causes it, right? So I was reading, this ties up with our the mindset, right? So mindset is the foundation with which we build our nutrition, we build our fitness, we build our sleeping, everything, because that is whatever we focus on. Whatever mindset goes to whatever our subconscious believes to be true. This was written by Dr. Hamel. Why don't you tell us about leaky brain and what causes it?
Sure. So leaky brain is pretty close to my heart because that's actually what predominantly got me into alternative healing. So some of
Mm.
my health issues I mentioned prior is I used to have Lyme disease. I used to have like tons of other types of infections. I had a lot of brain injury I had no idea about.
Oh,
And
wow.
so a leaky
What?
brain,
Wait, I'm sorry, real quick. You said you used to have Lyme's disease. That means you are healed from Lyme's disease?
yes,
No
yeah.
kidding.
I'm healed. A lot of my patients are healed. You can be healed from Lyme disease. I personally, uh, I don't feel that any diagnosis is permanent, and that's just that's a lot of mindset training.
Yes.
But I really don't believe any of us are meant to hold or to have things, and I think you just have to keep finding things that not everything works for everyone. But yes, I've been free for it for like over 6 years. Um,
Wow, that's
Many of my
phenomenal.
patients get free from it all the time. Doing other modalities, I've heard of people get free from it. So yeah,
Wow.
absolutely.
Wow. I actually was under the impression that Lyme's disease was forever. You can't get rid of it. But guys, as you could hear, everything is possible, especially with alternative medicine. There are many modalities that haven't been unfortunately implemented in, like I always say, orthodox medicine. So this is phenomenal. I mean, for those of you listening, if you know someone who has Lyme disease, definitely reach out to Dr. Hamel or a local cranial practitioner. Did I say that right?
That was great.
And thank you. And so it's great. Thank you so much for answering that. Were you done? Because I didn't mean to cut you off. I'm
No,
sorry.
I wasn't done, but that's okay.
Go ahead. Keep going.
So when we talk, and I will mention too, I don't really like broadcast that I treat Lyme, because I don't. I treat the whole body as a system, and I think when you do that, you can really achieve health and wellness. But to get back to leaky brain, so leaky brain, all that it means is there is actual leaks in your blood-brain barrier, and
Mm.
a lot of people know by now, if you've been in the health world, or they're familiar with something called leaky gut. And that is where there's actual leaks in your gut barrier. The same thing can happen with your brain, where you can have actual leaks or tears in your blood-brain barrier. And so things that are meant to stay in there, like ketones and glucose and oxygen, don't. And things that are meant to not be in there, like pathogens and toxins and all that stuff, come in.
Mm.
And so that in itself can be very inflammatory. It can cause things like migraines or TMJ or headaches or systemic chronic inflammation. And there's many different causes to that. So the first cause I kind of already mentioned, my journey, is infection. So you can get leaky brain from certain infections like Lyme disease or like mold or mycotoxins, or you can get it from parasites. They can all kind of eat into the blood-brain barrier, which is kind of gross to think about, but they do.
Yeah. Mm-hmm.
That's one of the causes. There's also certain toxins that can actually break the blood-brain barrier. There's certain heavy metals. There's certain medications that actually cross the blood-brain barrier. There are radiation, we know, so electromagnetic frequencies can break the blood-brain barrier. So those are more like toxicity ways to do that. The second way is through head trauma or through chronic postural problems.
Mm-hmm.
Because again, like I mentioned at the very start, if we don't have oxygen, if we don't have blood flow, things get compromised. And so when you think about a head injury, certain vessels, certain things can tear, they can be weaker. And so when that happens, then there's a disruption. There's a disruption in that pattern, and it can cause then leaks to start happening. And then the third way you can get leaky brain is kind of what you mentioned when you were entering into this question, is mindset. So when you have a very toxic mindset, when you have a very toxic thought processes, which is probably one of the most, I will say, hardest things to overcome when you get someone in your office with chronic pain or chronic illness, is overcoming a toxic mindset. But I will say that is probably, if not, I don't like to categorize important things of treatment, because one might be more important for one person than the other. But when you start to change toxins that are in the form of emotions, you can get some really phenomenal healing results with a patient, especially someone chronically. When you get people like with chronic Lyme or chronic illness or chronic pain, they have all of these very subconscious patterns that sabotage their healing. They sabotage the healing process, and you don't even know it because you're just used to it, and you're used to agreeing with the lies of those subconscious thoughts. So that's kind of the third way that you can have a leaky brain. And it's really important to heal a leaky brain as well as healing a leaky gut. They always go together because there's a connection between the brain and the gut. And usually it starts with the gut, but you can always have just a head injury that leads to leaky gut too. So those are kind of the top 3 reasons. It goes in order of how we treat it, but there can be many causes for it. And someone might not have the late stage symptoms like anxiety or depression or systemic inflammation. They may just have like a headache or, migraines were the one for me where I'd get severe migraines with Lyme and with leaky brain or sinus issues. Those are all more systemic things over time that can happen.
Wow, this is extremely interesting. We've talked about this in my other podcasts with other practitioners, but it comes to show you how we always talk about positive thinking, doing something to manage your emotions. And it comes to show you that, look, even in also this arena, it's so important to have a good mindset in order to heal. It's not just the physical area. And we've talked about this before, and we sound like, I always say, like a broken record, but it's so important to have that mindset to help mitigate your symptoms and also help you on your healing journey. So this is phenomenal. Thank you. I'm loving all this information. Thank you so much for sharing that.
Of course. And it's quite sad because I don't fully understand why, but a lot of providers, health providers, they just don't really want to tap into the emotional part of healing. When if you really look into the research of thoughts and processes, thoughts trump literally everything. So, I know it can seem a little daunting, but if you're a practitioner, even if you're listening to this, start looking into emotional help for your patients, even if it's referring them to someone else who does emotional help. It's really, really key to getting someone over something. And if they don't know their mindset is toxic, then they need help navigating that to reach, their miracle or to reach, the goal of healing that they have.
That's very important what you just said. Oftentimes we don't know that we're in that state. We don't know. If you don't even know that you have a negative mindset, how are you going to even begin to address that part? So excellent point. Thank you so much for bringing that up. What would be one way of someone who doesn't know they potentially have a negative mindset for them to kind of find out if they actually have it? I don't know if that makes sense.
Yeah, so one of the practices, which I didn't know when I first started this work, how negative I was or hard I was on myself, is you just start guarding your thoughts, and you either write down or you start to track really either what is coming out of your mouth or what you're saying to yourself throughout the day. So I had to switch a lot of my wordage to, like, I would say a lot of things like I can't, or never. Those are big words.
Yeah.
And they're heavy words. And when I started like looking into those and writing them down, I was like, oh my gosh, I see that so many times. And it's redirecting certain words like that. Like instead of saying, I can't, you say, I'm on the process of healing, or I'm on the road to healing, or maybe I couldn't, in the past, but that doesn't mean that I won't. And so it's starting to like really work those. And for instance, if someone is really ill and say they can't even walk like to their yard and back, if they have a day where they are able to do that, you need to celebrate that. You need to celebrate that. I don't care how long you celebrate that. That's a win. And that shifts momentum in your mindset. When you make a shift in your mindset, like someone can just come in and I just give them an answer. I haven't even treated them yet. And you can see the shift happening, and they're just like, you have given me hope. And that's the power of mindset, is when you give someone hope, you shift so much chemically shifts in your body and in your brain. And that can be done in many different ways. But that's why when you start celebrating those little wins, like, hey, I walked to the yard, or hey, I was able to like, do a gentle movement class or something like that. Whatever it is, you have to celebrate it. It may not be a big win in compared to what you're used to, but you are on the road to that. And there's probably something deeper that you need to work through this process that you couldn't if you were healthy. So there's always perspectives to that. It's just shifting the way you're thinking about that healing process.
That's awesome. Well, guys, remember what Dr. Hamel just said. Celebrate those little wins, those little things that you achieve every day. I think that's also part of how you start shifting that mindset. So that is great. Thank you for answering that. Now we're going to move to the next one real quick. So you mentioned a connection between the gut and its relationship to the shoulder, back. Why don't you explain that a little bit? That sounded pretty good.
Yeah. So tracking back to my point a couple questions ago about leaky brain and leaky gut. There is something called the gut-brain axis, where your gut, in essence, has its own nervous system, and your brain has its own nervous system. And what happens is when there's a disruption in that nervous system is we start to see severe health implications happen. So that's why I always, I talked about concussions and things of that, because if there's something that cut that connection, we got to heal that first. Now, when we talk about the gut, for instance, or we talk about any other organ has a nerve connection. That's what makes it work. It comes from some area in the body, your spine, somewhere else in your body, that makes that action or makes that organ work. And when we talk about the gut, one of the most common things I see when there's gut dysfunction happening is there's a valve that connects between your small intestine into your large intestine. That valve is called the ileocecal valve. What happens is that valve needs to open to allow things from your small intestine, which is all like your digested food or your leftovers from your digested food, needs to come in to your colon so you can eliminate it out of your body. But then that valve needs to shut so that things don't backflow back into your small intestine and create a lot of inflammation. So what I see happening is that when there's a shock to the nervous system, like I mentioned, thoughts, traumas, or toxins, that valve can get disrupted. And so because it's either left open or left closed, that means that there's inflammation. And since each organ is controlled by a nerve, that means that nerve is not going to work as optimally. So when I say there's a gut relationship between your shoulder, or there's a gut relationship to your back. That's what I'm mainly talking about, is that nerve connection. Because all the cells of your body talk to one another, all the nerves of your body talk to one another all the time. That's why you can't treat one body part alone. It doesn't work. When you look at the colon, let's just talk about the colon. The nerves that go to the colon start from the lowest part in your spine. Okay, so it's your L2, your L3, your L4, your L5, L1 through L5. So say that, and it can go either way. So say you hurt or injured your back, you could also have a colon malfunctioning, okay? Or say that valve gets dysfunctional, you could have pain in your back. And so this is where people can chase pain, because I always say pain is usually never where you feel it.
Yeah. Yeah, I
The
learned
body
that.
is so complex.
Yes.
So, you know, like if someone comes in and they've had chronic low back pain for like ever, you know, we want to first make sure we look at all the structure and the airway and all that. But we want to say, okay, is there something else referring pain or making that nerve not work properly? And so that's why I've had people, we calm down their gut, we work on some different organs, and they're like, oh my gosh, or we clear anger out of their liver or something like that.
Wow.
And they're like, oh my gosh, my shoulder feels so much better. My jaw, my head feels so much better. How is that possible? Well, they all talk to one another. So if you just look at all those intricate connections of the body, of where the nerves go to each organ or go to each level, then you can really gain insight of, okay, I'm feeling pain here, but maybe it's not really coming from there. Maybe it's coming from something else. And so that's the fascinating part of the body, is just all the magical divinely created connections that we have, and how they're all intricately woven together. So I hope that answered your question. I know that was kind of a lengthy answer, but they just work together. They just all work together.
It absolutely answered my question. I love lengthy. for those people who know me, I love details. I love it. It was great. Thank you for explaining that. And also, like, I was just thinking, as you're mentioning, you know, back pain and potentially connected with the colon and other areas, like usually if you go to regular you know, physical therapist or like that, they'll immediately obviously look at the area, you get some physical therapy,
or usually opioid.
or worse, an opioid that is just gonna like, I gotta say this, and I don't know if you agree. I always thought about, because I had, like we were talking about before the podcast, I had a L5S1 herniated, and I was gonna, while we're at it, I started doing physical therapy and also addressing, you know, other my lifestyle, sleep, everything that we know in the functional medicine, alternative medicine field. And I felt so much better. I was able to work out again, and I actually went all out with the workout. That was a whole other story. But can you, like, I no longer get those crazy flare-ups when I sit for extended periods of time. I start feeling it in my back, but I no longer get those crazy flare-ups. Would you say that I basically reversed my disc herniation? I haven't had an MRI because I don't like X-rays for obvious reasons. But would you say, how do you know that you're kind of healed your back besides just the pain? You know.
Yeah. Well, I mean, individuals come in with pain all the time, and that's never like my, you know, obviously I want to get them out of pain, but it's always about function, how functional a person is, and in a healthy motion. If you go on the street and you ask 1 out of 3 people to go get an MRI, you're going to find a disc herniation in almost every 1 out of 3 people. Yeah. So disc herniations do not equate to pain. Because it's just matter how your body functions and how it compensates and things of that nature. So if the pain for you personally has mostly eliminated, then I'd say there's probably other factors than just the disc herniation that was really aggravating your symptoms. And that's the problem, is when people I love testing. I love diagnostic testing. I utilize it a lot. But we can get into this mindset of, okay, here's your problem.
Yeah.
And then people do the things and they don't get well because either, number one, either the provider's not really doing the right things, or number two, you're just looking at there, but you're not really looking at your overall of how your body is all functioning as a unit. And when you do that, you get from this like tunnel vision of just diagnostic testing. The Mayo Clinic spends like the most money in the world on diagnostic testing, and
Wow.
they have a 33% failure rate.
Wow, that's pretty
So
high.
diagnostic testing does not equate to healing. It can give us information, like an MRI for a disc can give us information. But again, it's all about how the body works as a unit. Are you taking care of those three tiers? Emotional, chemical, and physical.
Yeah.
And when you do that, then you're like, yeah, I have a disc herniation, but I can do all my functions and I'm in a healthy environment. I'm not worried about the disc herniation.
That's a great approach. Love it. Thank you so much for answering that. Now we're going to move quickly to, I don't know how much time we have, but I found something really cool on your posts and also new information for me. What is the impact on the vagus nerve? Wait, what is the impact of a vagus nerve infection? I'm sorry. That I actually never heard of either. So this is all new to me. And so why don't you tell us a little bit about that?
Sure. So the vagus nerve is not like Party Vegas. It's one of the nerves, the cranial nerves that come out of the skull. Mm-hmm. These are, again, part of that really calming part of your nervous system. And so it can be impacted, that vagus nerve can be impacted in different ways. And really why we focus on it a lot is because it does put your body in a state of healing. It's calm, it's relaxing. The vagus nerve, just like a lot of your other cranial nerves, also control your digestive tract. So if there's an injury to the vagus nerve, you can also have digestive inflammation or disconnection there and can cause inflammation.
Wow.
So I always first look at, where is the vagus nerve? It starts here. It goes all the way down to your abdomen. The long nerve. So you can stimulate it by diaphragmatic breathing. You can get it nice and open. You can get it open by working up here in the chest and in the neck. And then you can get where it initially comes out, which is the back of the skull, these two bones here, your temporal and occiput bone. You can remove the pressure there, and you can relieve it, and you can allow the vagus nerve to work more properly. That's the first way. Now, since the vagus nerve has, it comes out here, it can also, nerves are very attracted to certain things. So they attract metals and toxins, and they attract infections, unfortunately.
No kidding.
Wow. No kidding. So as we talked about a little bit previously about leaky brain, when infections get in, the infections can actually leach on to certain nerves as well. And people can get like a nerve type of pain, or, that nerve just really isn't working because there's a high infection load there. So when we talk about someone maybe having a root canal infection directly in the head, or they have a sinus infection, and these are very common actually. Infections in the mouth are very common. Nobody looks in them. Or say they have those amalgam fillings, they have mercury in their mouth. Those are toxins that are going to attract to any nerve, but the vagus nerve gets really commonly irritated. And so when you have kind of a vagus nerve infection, then again, you can't utilize it necessarily the way that you want. So it puts the body more in that state of shock or parasympathetic mode. Mm-hmm. So we want to attack the infections, of course, or the toxins, of course, if that is the root cause of the vagus nerve always being irritated. But sometimes I first just have to do some of those calming things first, just to get the body more balanced. And then we look into, okay, what toxins are in there? What infections are in there? I work with a ton of different holistic dentists and orthodontists. Those are a lot of my referral partners. And we look at, okay, is there something going on in the mouth that I can't see that's feeding into some other area and affecting the vagus nerve? So it can be impacted many different ways, but you can get toxins and infections leaching on to certain nerves as well. And that can impact the calming state of the brain or the way it works in that healing environment.
Wow, that's mind blowing. I've actually been reading quite a bit. There's Dr. Lynn, I don't know if you're familiar, online, and look, it's on Instagram, who talks about a lot about that, you know, like your dental health, oral health, if you will. It's actually pretty
Huge.
huge, right? When it comes to infections, all the diseases, we all know root canals. I am actually looking to get rid of my root canals. And actually, what I went to see a biological dentist, and he was actually like, "Oh, you know, we want to save the tooth," things like that. But these are things like they measured my pockets, they measured also movement in each tooth, and
Yes.
conventional dentists don't do this, you know. And
No.
so sometimes people are
Electro.
like, right. And so I was like, movement of what? And they're like, you know, feeling every tooth to see whether they're loose. And he's also talking about the overbite, which nobody ever told me. You know, at first sight,
that's airway. Yeah, that's
right.
Airway.
There you go. So all these things are so, and I love the fact that, look, Dr. Hamel works in conjunction with, I'm assuming holistic dentists, right?
Functional dentist, biological dentist.
Functional, biological, and look what a beautiful thing. It's like she works with a team. You are being taken care of by this is so phenomenal. I can't just, you know, you don't get this in conventional medicine. I'm sorry. I have the utmost respect for emergency, you know, surgeons, all of that, but we need, it's the system. You know, we've talked about it in other podcasts about the health system, how things need to be reshaped in terms of there are beautiful doctors out there, nurses, everything, but we need to change that. So thank you so much for explaining it. This basically concludes our podcast. Is there anything you wanted to add, Dr. Hamel?
I think we've probably like poured a water hose on most people, so hopefully it wasn't too much information. But yes, that is always my goal, is I love working with people and coordinating care with people. So, you know, just find people that are on your team and listen to you. You need a practitioner that listens to you, and listen to yourself. Don't disregard your intuition or how you feel. If you feel like something's wrong, it's probably wrong. So go with your gut.
Absolutely. Well, thank you so much. So guys, this concludes our podcast. I just wanted to mention that you could connect with Dr. Hamel online. Let's see. Her website is drrachelhamel.com. That is www.drrachelhamel.com. You could actually purchase, she just created her own brand of MCT oil. So you could learn more about it there and purchase it. Also, you could reach out and definitely follow her on her Instagram account under Dr.Rachel.HamelDC. And also on her Facebook at the same name, Dr. Rachel Hamel. You're going to have access to all of that in the her dedicated page on my website. And well, thank you so much for being here. I learned a ton. I know our listeners are going to learn so much. They're going to love it. And I cannot wait to have you back.
Yeah, thank you so much for having me.
No problem. Thank you for being here.